Hi, Ella.
Hello.
Do you want to tell me about the last time you had a faint?
Okay, so I've had a couple episodes of fainting where
Mm-hmm.
I felt lightheaded, dizzy. It tends to be when it's hot or if I've just stood up or been walking around a lot.
And tell me if you had any symptoms before you fainted. So the so-called warning symptoms. Did you feel?
Yeah, disoriented,
Mm,
some vision loss sometimes.
And did you have a feeling of anxiety or any feeling of
Uh, mm,
breathing difficulties or palpitations, perhaps?
Maybe palpitations, a hard heartbeat, a thudding.
Okay. And how long were these warning symptoms for before you actually lost consciousness?
A couple of minutes.
Okay, fine. So what I'm going to say is Ella presents with a very typical history of fainting. And with fainting, what we need to establish is risk factors or trigger factors for fainting. So she's described standing up or immediately standing up, staying with a prolonged standing state in hot weather. Any other trigger factors that have been present in some of your other faints that we haven't mentioned, Ella? So standing up, hot weather, prolonged standing, immediate standing.
Yeah, sometimes eating as well.
Eating, okay.
During meals, after meals.
Okay, and with alcohol, without alcohol?
Maybe. I don't know. I've
Okay.
noticed.
So the other very typical trigger here is postprandial syncope, which is after a meal, one might get faint or feel faint. And the reason for this is actually, when we think about fainting, this is a process physiologically, which is a bit as follows. I'm going to make a prediction that you have generally got have a low blood pressure. Is that right?
Yes.
Yeah, good. So if you have a low blood pressure to start off with, anything that forces dehydration, such as hot weather, and anything that pools blood in your lower limbs or in your splanchnic bed, which are the tummy vessels, such as having a big meal with alcohol, or with alcohol vasodilation, which means if you look at Ella's cheeks now, it's a bit red, and if she blushes and has alcohol, it might get a bit redder, and the skin is the largest organ. So when we shunt blood away from our core circulation, which is our heart and your head, and it goes into the skin, or it goes into the lower limbs as you stand up, because gravity pulls blood from your head, from your heart, down into the lower limbs, you might get a low blood pressure state that leads to fainting. And the key thing here is before that faint occurs, in the 30 seconds to a minute before, you have what are called prodromal pre-syncopal warning symptoms. And that essentially means the body's reaction before that blood pressure drops is to give you an adrenaline surge. And that would explain the pounding rapid heartbeat. It could also explain why you might feel a bit anxious if that was one of the symptoms, but also the blurred vision, maybe sweaty, dizzy, and feeling generally uncomfortable. And I hope that goes some way in explaining why you might have felt the way you did before fainting.